Hi, I wanted to vlog really quickly about something that I'm doing for the first time, and that would be this delightful drink. See, it's a little bit chunky. This is my first time trying it. Okay. It's not the world's best stuff, but it's not the world's worst. It's sort of like tapioca, and vanilla-y. And I'm going to try and drink a little more. And my hair is bothering me. It won't look good down either. I'm having a rough week, which I will vlog about soon, but I've got some other things to do first. But I'm already on the medium chain triglyceride protocol, and that was for anybody that's having a bad case of Neuro Lyme in my clinic. But sorry if that's gross. I missed my last appointment. I mean, I was there physically. My family drug my body in physically, but I was out like a light. Like they couldn't shake me or move me. It was sort of scary. So my family attended my appointments, and I really didn't. But I guess what I missed at that appointment was something important. I understood that I was doing the medium chain triglycerides, and that everyone with bad Neuro Lyme was, and that that I was doing the new Yes supplements. I don't have them right here. But what I didn't know was my most recent brain testing is showing mild to moderate Alzheimer's disease. Now, we all know it's the Lyme. Alzheimer's disease is not genetic in terms of my family. I'm not saying it's not genetic, and I'm not well read on Alzheimer's disease, but in dementia, I used to work with some patients through a program, socializing, but so I know some things. But anyway, what I missed at that appointment that people failed to tell me was that my neuro symptoms have increased to the point where my brain is looking like that of someone with mild to moderate Alzheimer's and someone with the onset of Parkinson's, which would explain why I've been tremoring and stuff. And I just casually made a comment to my dad the other day about it, and he said, well, yeah, and he sort of referenced my last appointment but didn't say anything specific. Well, this stuff had been ordered for me. It's a medical food, and it hadn't come into the pharmacy yet because not a lot of people are doing it. I mean, maybe a lot of Lymies and Alzheimer's patients are, but through my pharmacy there weren't a lot of people, so they had to order it. So it came in, and my dad brought it over, and I was like, this stuff says it's for mild to moderate Alzheimer's. And he said, well, that's what you're showing in your brain scans and your blood work. And I was like, oh. And he was like, I thought you knew that. And I was like, no. So that happened on Monday, and I've been really bummed out that no one told me, and a little scared and stuff like that. And my doctor, when I'd seen her, had been making comments like, you're lucky you've been in the theater and been writing for so long, because that part of your brain is really strong and really well exercised. So, you know, your ability to memorize lines and stuff like that is good. But I also knew, like, I have no existing short-term memory. I was at clinic today for an IV, and I was talking to the mother of someone who is similar to me, and she's lost her short-term memory also. Like, we could have a whole meeting of people in our house on a Sunday for the theater or something, and then the next day I don't remember that. Working on lines I can remember because it's repetitive and it moves beyond short-term memory, but so I'll fully participate in the meeting. It's not like I'm a vegetable. But then the next day I'll be asking someone from the theater or my husband, Cooper, when we're going to have that meeting, and we will have had it the day before in our own home. Which is awesome. And I'm glad I'm trained to remember things in print. But anyway, I'm not psychologically or emotionally, like, linked into this fact about me yet. And I know that it's really a common thing, but it freaks me out. We were all seeing brain damage and hypoxia and things like that, but not of this caliber until recently. So anyway, this is a medical food that I'm going to read you about really quick. It's called Axona. And this is the packet that this stuff just came out of. Axona Medical Food. And for the clinical dietary management of the metabolic, no Cooper, processes associated with mild to moderate Alzheimer's disease must be administered under the supervision of a physician. And then it says directions for use. Each packet of Axona powder should be added to 4 to 8 ounces of water as preferred, shaken or stirred until fully blended, and consumed immediately. Patients should drink Axona once a day during breakfast time. It's the middle of the night, but this is when I first woke up and I've been having my apples. The cautions are: Axona should be used with caution in patients with known hypersensitivity to palm or coconut oil, at risk for ketoacidosis, a history of inflammation of the gastrointestinal system, which I have, metabolic syndrome, and or history of renal dysfunction. Axona contains caseinate, whey, and lecithin, plus contains milk and soy. And then it comes in this giant box, Axona, and inside are all of your packets. And I got it Monday, but I have been hesitant to take it because I didn't want to deal with the reality of why I need to take it. Ridiculous, I know, but we just have to adjust to things slowly. And I was living in fear that it would taste horrific. I'm glad to know that it doesn't. It's not my favorite thing in the world, but I'm doing okay on it. Here's the stuff from the pharmacy. Of course, it gives all the disclaimers. This information is a summary only. It does not contain all information about this medicine, blah, blah, blah. Common brand names: Axona. This medicine is used for dietary management of patients with Alzheimer's disease. This medicine is a medical food. It works by increasing ketone levels in the blood, which may help provide energy to the brain in patients with Alzheimer's disease. How to use this medicine. Use this medicine as directed by your doctor. Check the label on the medicine for exact dosing instructions. Take this medicine by mouth with breakfast. Add this medicine to 4 to 8 ounces of water. 4 to 8 ounces of water. Shake or stir until completely mixed. Drink right away after mixing. If you miss a dose of this medicine, take it as soon as possible. If it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Do not ever take 2 doses at once. Possible side effects of this medicine. Then it gives the disclaimer. Most common are diarrhea, headache, heartburn, gas, nausea, upset stomach. Seek medical attention right away if any of these severe side effects occur. Severe allergic reactions, rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue. This is not a complete list of all side effects. Some medical conditions may interact with this medicine. Tell your doctor or pharmacist if you have medical conditions, especially any of the following. If you are pregnant, planning to become pregnant, or are breastfeeding. If you are taking any prescription or non-prescription medicine, herbal preparation, or dietary supplement. If you have allergies to medicines, foods, or other substances, including palm or coconut oil. If you have a history of kidney problems, stomach or bowel problems, irritable bowel, inflammation, diverticulitis, or gastroesophageal reflux disease, GERD. If you have diabetes that is not well controlled. If you have a history of alcohol abuse or dependence. Some medicines may interact with this. However, no specific interactions with this medicine are known at this time. So this is my first time taking it. Again, it's called Axona. And it comes in a packet like this, and you mix it with 4 to 8 ounces of water. It's not horrid tasting. And I'll probably talk about it more later, but since it was the maiden voyage of it in my mouth, I thought I would share that and then update about it later. You're in my thoughts and prayers, and in my thoughts even more than in my prayers. That's not to say you're not in my prayers, but I think about you guys all the time. Thinking about starting favorites again, just because I know we're all having a bummer of a couple of weeks. Like, everybody seems sick. Sally New was making that comment in my text earlier. So, love you lots. Hugs and kisses. Extra huggy, kissy, smooshy faces. And I'll talk more about this charming update later. Be well until I see you again.